Hi, my name is Davino Beckford, and I work as a peer researcher at the McPin Foundation. I'm currently working on a project with Black Thrive, which is a project essentially aiming to improve the employment outcomes for Black people living with long-term health conditions in Lambeth. I also work as a Children and Young People's Public Involvement and Research Coordinator, facilitating multiple young people's advisory groups. I am and have been interested in public mental health as someone who has lived experience of mental health struggles, as well as knowing some of the struggles of navigating the mental health system. As a result, I want to be able to contribute, however small, to improving the mental health and well-being of others. Over the past 2 years, I've been using my personal lived experience expertise alongside my skills as a psychology graduate to deliver a range of projects at the McPin Foundation. It's been an interesting time because I started this work during the pandemic. That has been challenging on lots of fronts, but one good thing to emerge is increased public awareness of mental health struggles. This puts an even greater emphasis on public mental health too. So I'm pleased to be talking to you today as one member of the public, but thinking about many other people up and down the country. Mental health is of course an important focus for the School of Public Health Research. I know it's been a program over the last few years, and I'm pleased mental health will be a dedicated program of work in the next phase too. It must be, because despite all the work being done to improve the outcomes for people affected by poor mental well-being, we are only scratching the surface of what there is to be done. There are so many unanswered questions. Like, how is racial trauma experienced by different marginalised groups across the UK, and what bespoke supports and solutions do we need in place to tackle racial trauma? How can we reform systems such as education, criminal justice, health and social care, and welfare so they are less likely to cause and exacerbate individual trauma experiences? So I'm really pleased mental health continues to be a focus in the School of Public Health Research. And it's hard to untangle mental health from some of the big issues facing our society. Poverty and the cost of living crisis, conflicts, including refugees fleeing war zones, climate change, the aging population experiencing loneliness, widening inequalities. In my opinion, I think one of the biggest issues faced by the public regarding their mental health are inequalities and the oppressions they cause. We need research to help us find solutions and increase understanding, and the public are a huge resource to help us do that. So of all the areas I could talk about, why inequalities? Because the focus of my work largely for the past 2 years has consisted of work in racial equity, addressing the current employment system that seems to be failing for Black people, those living with disabilities, and those at the intersection of this. I was part of a working group, all of us representatives of our local community. We were given resources to fund local projects to make a difference for Black people. We took a long time, meeting regularly to decide how best to set up this funding program, how to make decisions, and then who to fund. The community funding model is very powerful, and I saw how small grants can lead to new ideas and partnerships being born. People ran with these grants, empowered by the investment and the belief in them. We also adapted the process so people who found it hard to fill in forms could submit a video application. If you want to be inclusive, you have to change your processes. I think that's important for research too. Additionally, as a Children and Young People's PPI coordinator, I have helped facilitate multiple YPAGs that are focused on involving young people in research. One in particular was a YPAG supporting a project tackling anti-LGBT bullying in schools by investigating how whole school interventions can be used to improve the mental health of young queer students. This project was rapid. It was a 3-month piece of work funded as part of the Wellcome Trust Active Ingredients program, but it brought to the fore lots of issues we need to follow up on. By taking an inequalities approach to improving public mental health, the focus shifts to things that the current mental health system cannot solve. We not only seek to improve the mental well-being of those receiving the care, but also dismantling the systemic barriers, attitudes, and behaviors that we know also contribute to poorer mental well-being. I like the focus that public health takes to looking to the community for solutions, not only NHS settings. I know that research funded by NIHR, including the School of Public Mental Health Research, places a strong emphasis on PPI. It's interesting to think about what that means for public mental health research. Who are the public? Aren't we all the public? I understand that currently the approach is to consider different public perspectives for individuals who have experienced forms of trauma. This is a good approach and opens up avenues for a lot of people to contribute up and down the country. We want to involve diverse public expertise in the next phase of the public mental health program. One idea is to have multiple different dimensions and layers of involvement to give people choice. This would include the public in employed roles such as peer researchers, integrating them in project teams, and having a PPI coordinator anchor role embedded in the research program. We want to make it a greater priority to welcome more community organizations, link the projects into this research program. It would also mean having public partners involved as advisors on individual projects. A key priority will be both reaching new and diverse audiences with involvement opportunities and building strong relationships with all partners, including between academics and the public. The more we integrate our expertise, the better it is in my experience as someone with feet in both the lived experience and the researcher shoes. Thank you for asking me to contribute to this meeting today. For this program to continue to be a success in my eyes, we need research that is useful and that is not just research for research's sake. We need research that will actually address inequalities and therefore alleviating the impact they have on people's mental well-being. I know I might be one voice speaking here today, but I am basing my words and intentionality behind them on all the work I have done and have been doing thus far in my life, as well as sharing my perspectives and experiences of those I encounter as a young person living in London. Thank you.